Hey, Bill, I figured I would just post a video of this because there's a lot going on here. When he flared with his right leg and felt a sharp pain on the left of his kneecap, so on this side, after going to a butterfly a few more times, it started hurting in that spot every time he went down. Woke up the next day, the pain was sort of above his knee. Any idea what happened? So again, thanks so much everybody for jumping in and trying to help Bill out. I totally appreciate it. But I also wanted to go over this because I think this is a really good example. So when he butterfly, this is, you know what, I'm going to go out in the gym so we can look at this better, and I'm going to see what you guys see. So when he flared out or put his right knee out, he felt a pain here. Your MCL is here. It's on the inside. Now, again, it can get injured more often when somebody falls on it or if it's a really awkward position, but he had pain on the outside. And the outside of his kneecap. So we think right away, I think one of two things. One is, did he sublux his kneecap a little bit? So some people, and it's not actually that uncommon, but some people, you know, there's a lot of force. So my quadricep muscles come down, they make a quadriceps tendon here. My kneecap is actually engulfed in the tendon, and then they attach here, and this part's called the patellar tendon. Muscles pull in straight lines, not around corners. So if I'm a little bit, sorry if I'm making you seasick, if I'm a little bit like this and getting a strong contraction of my quadricep, well, can you see how this is trying to pull my kneecap around a corner? And where is it going to want to go? It's going to want to make a straight line like this. So my kneecap is going to get pulled. And sometimes it will actually, frankly, dislocate. A lot of times it just subluxes. It gets pulled out sort of its groove, and then it kind of slams back in. So that doesn't feel good. So that is kind of the first thing that I thought, the way you described it. And especially since afterwards you're like, oh, and then I was kind of sore above my kneecap, because you would have caused some trauma also to those tendons and those structures. The other thing it could be is when I'm here, I'm compressing this joint space, this lateral compartment of my knee, and sometimes that will pinch a meniscus. Now, that's usually more like a real pinchy thing, like, ow! And when you get in the right position, it'll give you another, like, ouch! And I wouldn't expect it to be sort of so achy, be more like jabbing. So my money would be on a little patellar subluxation. And then there was a little talk about strain, sprain, yada, yada. So a strain is to a muscle, and there's grade 1, 2, 3. So grade 1 strain is like, yeah, there's like some fibers torn, but it's not, you know, it's not that bad. So it's sort of a very mild strain. A grade 2 is, yeah, there's a definite fiber disruption. You know, you can sort of a gap in the muscle where the tear actually occurred. And then grade 3 is like, no, this thing is like completely torn, which is really, really bad. And you don't see very many of those. So same thing goes with a sprain. A sprain is a ligament. So you sprain your ankle, you strain a muscle, but it's the same thing, it's tears, and there's grade 1, 2, 3. So 1 is, yeah, a little bit, but it's not really lax. It's just, you know, it'd be like if you just kind of mildly rolled your ankle. Grade 2 is, no, you've actually, you know, really torn part of it, but not completely torn. Obviously a little more serious. And then grade 3 is like, yeah, no, your ACL is gone. you know, so grade 2 and 3, you'll have instability, a little bit bigger deal. Grade 3, like if it's in your ACL or something, you know, you might very well be looking at surgery, that kind of thing. So that's that. This is fun. This is a good question. And then like Jared had some ideas about changing the equipment and that kind of thing, which you already used wearing you're all using house straps. Yeah, so I think that's it. You're going to see the doctor bill a little later. See if it's, if it's a doctor that has experience dealing with sports injuries, because sometimes, and bless them, they have to diagnose everything, and probably they're much more worried about missing a really bad illness or something like that in a patient than misdiagnosing a knee sprain. But if they're kind of like, oh, I think you probably sprained your knee, that's like, what does that mean? That's pretty wishy-washy. So if it's like, here's some anti-inflammatories and just don't do anything for a while, take a week off or 2 weeks off and then go back. Again, that might be fine because it let it settle down. And I don't think, if they prescribe some anti-inflammatories or something, probably not a bad idea to help it settle down that inflammation. But, if it just isn't like, yeah, I think you probably, it doesn't have to be subluxar patella, but they do a good diagnosis. They look at it, they ask you about the position, the mechanism, they put their hands on and test the integrity of your knee and different positions. That's pretty good. If you're just getting that, yeah, it sounds like you sprained your knee or strained your knee or whatever, take 2 of these and rest for 4 weeks. I would probably be looking for a really good sport physiotherapist who actually has the tools to do a really good assessment. And they would have seen, probably in the last month, they've seen 5 knees just like this, and they kind of have an idea of what's going on and what you should do next. So there's a very long-winded answer to a rather simple question. Gang, have a great day. Catch you later.